Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jacqueline Meredith. During this podcast, Dr. Roger Bedimo from the University of Texas UT Southwestern discusses PrEP barriers and potential solutions in adolescents. For more information about Dr. Bedimo and this program, and to follow along with the slides, please visit the links in the show notes. Now let's get started and hear what Dr. Bedimo has to say about this topic.
So here's the PrEP uptake in adolescents. Number one, highlighting the fact that they are accounting for a significant proportion of new HIV diagnoses, about 21% among those aged 13 and 19, and largely men, 84%. However, the PrEP usage is still very low among them, almost 20% of PrEP users, and 13% of those who account for these diagnoses in this demographic. HIV diagnosis among adolescents 13 to 24 years of age in 2021 by exposure category, mostly men who have sex with men, and race and ethnicity, mostly Black. So if you have the confluence of these two, Blacks who have sex with men, you see a real significant need for prevention in that population. But there are barriers. We can broadly categorize the barriers into the patient or the people at risk, i.e. adherence barriers, and the providers. Actually, I would broaden it to the healthcare system in general. For the people at risk, there are barriers because they may not adhere because of adverse event, dissatisfaction with medical team, forgetting, other issues with depression, social stigma, lack of support, and so on and so forth. But we need to be, us providers, be aware of our own barriers because some of us are not aware of the need or indication for PrEP in these young people. We may be uncomfortable addressing difficult sexual history of this adolescents so that we can identify the level of risk. We may be uncomfortable with providing what we view as HIV medications because we may think that this is only for infectious diseases people or HIV providers. But PrEP should be something that everybody, every provider, general practice should consider. I wouldn't be concerned that the patients receiving PrEP may engage in riskier behavior, also known as risk compensation. Some people think that if you offer PrEP, you just licensing risky behavior because you give people an aura of invincibility because they are on PrEP. So this false perception should be addressed so that people can prescribe PrEP. So how familiar are you with consent laws for HIV prevention in your area? So this is just to make you aware of the fact that there are a number of barriers that are structural in terms of who can talk about sexually transmitted infection to an adolescent and who can talk about HIV and who can order the tests and order the medications. And so it's important to familiarize yourself with those laws in your jurisdiction. That way you can better serve your population. So as of 2022, all jurisdictions have laws that explicitly allow a minor of a particular age to give informed consent to receive STI diagnosis and treatment services. And jurisdictions differ as to whether HIV can be included in that consent and whether parental approval should be requested. So those are the two things that is important to be familiar with in your particular jurisdiction. So interventions to support PrEP adherence in adolescents, of course, these are groups of people who may consume different media and who may receive positive response to, who may provide positive response to different kind of nudges than people who are older than them. And so it's important to meet them where they are and understand what they will be likely to respond better. to. So systematic review of interventions for adolescents, they found the following. So that could improve medication adherence, enhance peer-based counseling, computer and phone-based counseling, text messages, adolescent-friendly clinics, same-day pill start. Many of you may be familiar with rapid antiretroviral therapy start for people who are infected, but it's also possible to do rapid PrEP start so that you don't waste steps. And because every step, every clinic visit is an opportunity to lose the patient. So now extended pill supplies. So this is something that was used a lot during the pandemic because we wanted to limit healthcare interactions in the time where we're worried about COVID transmission. So we were providing pills for longer duration. These are things that you may want to consider in this adolescent population. So, and the technology that they're more familiar with and more apt at should be harnessed, from mobile apps to electronic PrEP care systems to social networking to gamification. So those are all strategies, of course, that you could examine. So this is what the situation is for adolescents. They are at risk, and we need to meet them where they are.
Thank you very much to Dr. Bedimo, and thank you to our listeners for joining in. As a reminder, to view the full Contemporary HIV Treatment and Prevention 2023 program on the Clinical Care Options website, and to access the slide set for overcoming barriers to PrEP uptake, click on the link in the show notes. And please be sure to check back for more episodes on important infectious disease topics. Thank you and have a great day.